A new variant of coronavirus has been identified in the United Kingdom, and according to the British Health Secretary Matt Hancock, at least 60 different local authorities in England have recorded COVID infections caused by this new variant. The World Health Organization has been notified and detailed studies are being conducted.
We've currently identified over 1,000 cases with this variant, predominantly in the south of England, although cases have been identified in nearly 60 different local authority areas, and numbers are increasing rapidly. Similar variants have been identified in other countries over the last few months. We've notified the World Health Organization about this new variant, and Public Health England is working hard to continue its expert analysis at Porton Down. Mr. Speaker, I must stress at this point that there is currently nothing to suggest that this variant is more likely to cause serious disease, and the latest clinical advice is that it's highly unlikely that this mutation would fail to respond to a vaccine.
Matt Hancock has also added that there was nothing to suggest if it worsened the disease or if the vaccines would no longer work. Meanwhile, the World Health Organization has said that it was aware of the new variant of the virus that has emerged in Britain, but WHO Stop Emergencies expert Mike Ryan added that there is no evidence that the strain behaves differently to existing types of the virus.
We are aware of this genetic variant, I think reported in about 1,000 individuals in England, and the authorities in the UK and under Matt Hancock's leadership obviously are looking at the significance of this. We've seen many variants, as we've always said here. This virus evolves and changes over time, and we've seen different variants emerge. The question is, what is their significance in public health terms? Certainly looking at this particular variant seems to have become more prevalent in the UK. We'll obviously need to work with our international lab network to see if that variant is becoming more prevalent on an international basis.
We are now being joined by Dr. Julian Tang, who is an honorary associate professor and clinical virologist at the University of Leicester. Thank you so much for joining us, Dr. Tang. What can you tell us about this new variant? As we've mentioned, at least 60 different local authorities in England have recorded COVID infections caused by this new variant, and apparently it's spreading faster. What do we know about this?
Okay, so today the COG UK genome analysis team published some findings on their website. This is a N501 mutation in the S protein of the virus. So far, they haven't really found evidence for vaccine escape mutation capability or increased clinical severity of illness with this mutation. The question about enhanced transmissibility may be due to some in vitro lab studies that have shown increased receptor binding. Okay. But I'm not sure, and I haven't seen the data on how this translates to a larger human population. And we've seen this before. Earlier, D614G mutation was, again, had an enhanced viral load in some of the samples and was suspected to cause more enhanced transmission because of that. But so far, the epidemiological studies hadn't really shown that for that D614G mutation. So we really have to wait and see what the epidemiological studies show for this new N501 mutation to see whether it does actually enhance transmission in the real human population rather than just based on some lab studies.
Yes, exactly. I mean, as we did specify, that we did mention that there is nothing to suggest if it has worsened the disease or if the vaccines would no longer work. So when we talk of a new strain, what can you tell us about its implications? Not just in this particular case, as you of course mentioned, other variants of the virus as well. How does it translate when it comes to this transmission and spreading of the virus just in general?
I think like the WHO team was saying and UK team was saying that we have no evidence that this was really going to change the face of the epidemic. We don't see anything that is showing more severe disease or vaccine escape capability, and the transmissibility question still needs to be confirmed. But this is not unusual for a new virus. The new virus will evolve over time to adapt to its new host, humans in this case, and the virus does this to try and spread as fast as possible amongst the new host, but not to kill the host. Otherwise, it's no good for the virus because the virus needs the host to survive. And the virus will then eventually make its way throughout the population just like influenza does. and give everybody some level of background immunity, and then eventually become seasonal. So if it does spread quicker without causing more severe disease, then eventually we will reach natural herd immunity earlier. But again, we haven't got that conclusive evidence yet that it's spreading more rapidly than the current virus variants are. And there are lots of different virus variants out there. You may not be aware of this, but the classification of this virus includes 6 to 7 different strains, each of which has its own amino acid mutations to classify them for those strains. So these new viruses emerge all the time, and we give them a new name, a new classification, and we just monitor them for any potential for enhanced transmissibility.
Okay, Dr. Tang, thank you so much for joining us with all those details.